Number 7, remember that all 3 domains are marked in every single case, and that the management domain carries more marks than the other 2. A really damaging and common myth about the SCA is that it's all about and only about communication skills. Now, of course, being a good communicator is an essential part of being a good GP, but it's actually less than 30% of the marks in each case. The bulk of the marks in the exam relate to clinical areas. Data gathering, taking a focused, concise history, asking the right questions, excluding the relevant red flags, coming up with the right diagnosis, being systematic in your history, not wasting time asking vague or irrelevant generalized questions. These are all things that could affect your mark for data gathering, but that's clinical. Once you've got the right diagnosis, knowing what are the current guidelines for management, being able to discuss and explain that, knowing the relevant follow-up period, thinking about less common but serious things that could happen as complications that the patient should be aware of, i.e. your safety netting, and a plan for that. And there's lots to cover in that domain. Thinking about other important risks. To get all of that done needs a really good clinical knowledge of the current guidelines. Less than 30% of the marks are from the relating to others domain, which is about being person-centered, about explaining things in clear, understandable language, avoiding jargon and technical terms, being able to actively listen, pick up on cues and explore them, having empathy, having sensitivity in your choice of words where it's appropriate to the situation. So of course that's important. The bulk of the marks in this exam are clinical. Furthermore, most people that fail because of clinical things. More people fail because of clinical management and complexity than fail because of relating to others. It's important that you recognize I need to do well in all 3 domains in every case. If I want to give myself the best shot, I need to pay attention to all 3 areas. I need to actively demonstrate these things. I need to have a great working knowledge. I need to work on my time management, and I need to be a good communicator. Just focusing on one thing is not going to be enough for you to do well in this exam.